start today's session, let me take this opportunity to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead and to deliver superior and innovative care. Hetero Healthcare have established 300 products in portfolio and are pioneers in quality and innovation. So we have also launched 4 biosimilar products within last 5 years and have strong global presence in 125 countries. So the topic of today's webinar is enzymatic preparations with Papain advantage in dentistry. So to have this session, to shed the light, we are privileged to have Dr. Mohini Daultani with us. Welcome, ma'am.
Yeah,
Dr.
thank you.
Mohini, yeah. Dr. Mohini Daultani is an MDS gold medalist in the field of periodontology, implantology, and laser. She is also an associate fellow in laser dentistry affiliated by WCLI USA. She is also the brand ambassador of Dental Reach Digital Magazine, associate editor of Journal of Contemporary Research and Medical Sciences. She has bagged the most prestigious awards, to name a few: Periodontist of the Year by FAMDent Excellence Dentistry Awards 2021-24, Superstar Award by FAMDent Excellence Dentistry 2025. She is also the speaker at various platforms like Academy of Advanced Endodontics, Bangalore, ILMAD, Academy Mumbai. So she's the founder of Advanced Orthopedic and Dental Care, Vashi, consultant, periodontist, and implantologist at Apollo Hospital, Navi, Mumbai. Welcome, ma'am. So Dr.
Thank
Daludani, you can please start the session, please.
Yes, thank you so much. I'll just start my presentation. Yes.
Yes, ma'am.
Is the screen visible? Good to go? I can start, right?
It's visible, yeah.
Yes. So good morning, good afternoon, everyone. Myself, Dr. Mohini Daultani. So today we are here for the presentation that is enzymatic preparation with papain advantage. So this is the content, that's inflammation, process of inflammation, wound healing, need and product profile. So what is inflammation? So according to the Latin, it's like to set on fire. So what is inflammation? By definition, it is a localized reaction as a result of your physical trauma, irritating chemicals, infection by various viruses and bacteria, and injury. The inflammatory response is a natural defense mechanism that is triggered whenever body tissues are damaged in any way. Inflammations are of two types, external or internal. So what is the main goal of inflammation? It is to eliminate the initial cause of injury, remove the necrotic cells and tissue, and initiate the healing process. So when does the inflammation happen in your body? As you could see, you will have an inflammation as a result of either physical injury, stress, trauma, burns, post-operative wound healing, bacterial and viral infection, and insect bites. So what are the signs of inflammation? How do you recognize? So there are basically 5 cardinal signs of inflammation. The first is heat, second is redness, third is swelling, fourth is pain, and then you have loss of function. More the cardinal sign of inflammation present, more acute is the problem. And it can last for few minutes to few years. So as you could see, this is the process of inflammation. As you could see, here the bacteria, whenever they enter in, what do? They will trigger my macrophages. So this is a macrophage, and this pink color, what you see is a bacteria. So bacteria, they are triggering my macrophages, and that will release cytokine and chemokines. This cytokine and chemokine, they enter your blood vessels, causing vasodilation and increased vascular permeability, resulting in redness, heat, and swelling. So inflammatory cells migrate into the tissue, releasing inflammatory mediators, and that causes pain. So these signs are due to the movement of plasma fluid, proteins, and inflammatory cells from the lumen of your vascular system out into the tissue. Coming to your first inflammation, that is acute inflammation, it starts rapidly and it becomes severe. What are the signs and symptoms are only present for few days, but in some case, it may persist for a few weeks. Vasodilation happens, that is, you have increased vascular permeability. At the same time, there is immigration of your leukocytes mainly neutrophils and accumulation at the site of injury. So what are the example of your acute inflammation? It's acute bronchitis, acute tonsillitis, acute sinusitis, or else sore throat. What is a chronic inflammation? Inflammation of a prolonged duration, that is weeks to months. Lymphocytes, macrophages infiltration, tissue destruction by inflammatory cells, repair with fibrosis and angiogenesis. Many of these changes are also represent your repair process. Chronic inflammation does not have as much as redness or heat as in the case of your acute reaction. So chronic inflammation can result from failure to eliminate whatever was the cause of your acute inflammation, an autoimmune response to self-antigen. The immune system attacks healthy tissue, mistaking them for the harmful pathogen, or else a chronic irritant of low intensity that persists. So what are the mediators of your inflammation? You have chemical mediator that are of two origins. One is plasma derived and other is cell derived. So plasma derived, it consists of your complement proteins, kinins that circulate in active form. They typically undergo your proteolytic cleavage to acquire their biological activities. Whereas you have cell derived, normally sequestered in intracellular granule, rapidly secreted upon cellular activation or are synthesized de novo in response to a stimulus. Now coming to this mediators of inflammation, as we saw, cell-derived, plasma-derived. So in cell-derived, you have preformed mediators in secretory granules and newly synthesized factors. So in preformed mediators, you have histamine, serotonin, and in newly synthesized, you have prostaglandins, leukotriene, platelet activating factor, reactive oxygen species, nitric oxide, cytokines, and neuropeptides. Coming to your plasma protein derived, it consists of complement activation factors such as C3A, C5A, and C3B, whereas factor 12, that's your Hirschman factor. So the cell-derived mediators, specifically histamine, from the mast cells result in vasodilation and increased vascular permeability. Serotonin from platelets will cause vasoconstriction. Prostaglandin from mast cell and leukocyte will cause vasodilation, pain, and fever. Leukotriene from mast cell and leukocyte will cause increased vascular permeability, chemotaxis, leukocyte adhesion, and activation. Next, you have platelet activating factor that is from leukocytes and mast cell, resulting in vasodilation, increased vascular permeability, and chemotaxis. You have reactive oxygen species from leukocytes that will cause killing of your microbes and tissue damage. Next, you have nitric oxide that is from endothelium and macrophages, resulting in vascular smooth muscle relaxation. The next is cytokine from endothelium, macrophage, and mast cell that will have local activation, that is local endothelial activation, and systemically it will act by causing fever, metabolic abnormalities, and hypotension. The last is chemokine from leukocytes and activated macrophages, resulting in chemocytes and leukocyte activation. The next is your plasma-derived factors. That is the complement system from plasma will cause leukocyte chemotaxis and activation, direct target killing and vasodilation. Then you have kinins from plasma that will cause increased vascular permeability, smooth muscle construction, vasodilation, and pain. Then you have proteases activated coagulation from plasma resulting in endothelial activation and leukocyte recruitment. So just have a look about this flowchart. Whenever there is injury or infection, so cells like macrophages, dendritic cells, Kupffer cells, and mast cell, they all get activated. So they are your chemokines. Next, they will release inflammatory mediator responsible for your clinical sign of inflammation. That is just cytokine and prostaglandin. So these all ideally result in vasodilation, causing increase in blood flow. It will cause increase in vascular permeability, resulting in exudation of your plasma protein and fluid into tissue, causing edema that manifests itself as tumor. Then it also releases mediators such as bradykinin that increases the sensitivity to pain. Though inflammation is a protective mechanism, it can sometimes be potentially damaging Inflammatory process can often destroy or even damage a normal tissue, especially if it is not controlled or not required. So that is the reason we actually need to treat inflammation. So let us have a look about injury. What is an injury? It is a damage to your body. It is a general term that refers to harm caused by accident, falls, hits, weapons. These injuries range from minor to life-threatening situation. Injuries can happen at your work, play, indoors or outdoor area, driving a car or walking across the street. So whenever you have any kind of injury, you can result in wound. What is wound? Wound is a breakdown in the protective function of your skin, loss of continuity of epithelium, with or without loss of your underlying connective tissue, following the injury to the skin or underlying tissue or organ caused by surgery, sutures, cut or chemicals, heat, friction, cold, pressure. So what are the steps of your wound healing? So whenever you have a wound healing, first there is a blood clot. Then you have an inflammatory phase where you have fibroblast, macrophages, and blood vessel entering near your wound healing site. Next is your proliferative. As the name suggests, in this proliferative phase, there is a lot of proliferation of your fibroblast that will increase the circulation. And at last, you have remodeling, where there is freshly healed epidermis and freshly healed dermis. So these are your phases of wound healing. As we saw in hemostasis, first phase of healing, where the platelets are playing very pivotal role, that will release cytokine, chemokine, and hormones. Platelet come in contact with collagen that will result in clot formation. During this, platelets regranulate and release chemotactic and growth factor such as platelet-derived growth factor, proteases, and serotonin and histamine. This will act as this will attract your inflammatory cells to the area leading to the next phase. That is your inflammatory phase. It focuses on destroying the bacteria by neutrophil and removing the debris by macrophages and preparing the wound bed for the growth of your new tissues. There is increased vascular permeability and vasodilation. Plasminogen is here converted to plasmin, a potent enzyme that aids in your cell lysis. Macrophage also secrete collagenases and elastase that break down the injured tissue and release cytokine. Macrophage attract endothelial cells to the wound and stimulate their proliferation to promote angiogenesis. This phase lasts for 4 to 6 days and is associated with redness, edema, and pain. The next is your proliferative phase. Here it consists of different subphases such as fibroplasia, matrix deposition, angiogenesis, and reepithelialization. In days 5 to 7, fibroblasts migrate into the wound, laying down new collagen of the subtype. This wound is filled with your gags and fibronectin that will produce more amount of your fibroblast. Proteoglycans and gags that are bonded to a protein will cause matrix deposition. New blood vessels are formed and reepithelialization occur with the migration of cells from the periphery of wound and wound margin, contract, and pull towards the center. This wound is covered with epithelium and the proliferative phase will last from 4 to 24 days. And the last is your remodeling. So after third week, what happens? The wound undergoes a constant alteration known as remodeling, which can last for the years after the initial injury occurred, during which the dermis produces collagen and matrix protein and then returns to its pre-injury structure. Contraction of the wound is an ongoing process resulting in the proliferation of myofibroblast, which resemble your contractile smooth muscles overall. So what is the concern with my inflammation and pain? In general, pain is a symptom of some form of dysfunction and resultant inflammatory process. Many agents are available to reduce inflammation and relieve pain. However, their chronic use may cause a lot of side effects in terms of your gastrointestinal, cardiovascular, and renal. Over the past few years, researchers suggest that the role for more natural and safe alternatives for the management of pain and inflammation. Recent clinical studies have shown that Enzymatic combination is a very potent and safe in relieving edema, inflammation, and promoting the wound healing. So, what is the current need? Improved inflammation and pain management, faster wound healing, and lesser side effects. So, these are your main approach to treat. So, to treat this, we have come up with a very unique agent, that is Tolip, that consists of your papain, rutin, trypsin, and bromelain. So, how much does it contain? Trypsin is 96 milligram, bromelain is 180, papain is 120, and rutoside is 200. So, what are the indications of Tolip? When do you go for? It's for your edema, inflammation, for oral and implant surgery, for wound healing, jaw fractures, and disimpactions. So the dosage is 2 times a day for 5 days after food. So what does this proteolytic enzyme do? Enzymes are proteins that actually speed up your rate of chemical reaction. So as enzyme act as a catalyst for some chemical reaction, it will convert specific set of reactants into specific products. So proteolytic enzymes such as proteases are proteins capable of hydrolyzing your peptide bonds of proteins. Certain proteolytic enzymes have anti-inflammatory and anti-edematous properties, indicating the benefit in your inflammatory condition and immune regulation. So these proteolytic enzymes are derived from your plant, that is papain and bromelain. Animal derived is your trypsin, chymotrypsin, pepsin, and rennin. From bacterial origin is your serratiopeptidase and septilicin. Fungal, it's aspergillus. So trypsin, bromelain, papain show excellent anti-inflammatory as well as your analgesic action. So coming to your first content, that is your trypsin. It is a serine protease enzyme produced by pancreas. It is a globular protein produced as an inactive proenzyme called as trypsinogen. This trypsin consists of a single chain polypeptide, that is 223 amino acids. It is secreted into the duodenum via the pancreatic duct. Once into the duodenum, this enzyme enteropeptidase activates into trypsin to proteolytic cleavages. Trypsin in the duodenum will catalyze the hydrolysis of your peptide bond so that the protein can be broken down into smaller peptides. Trypsin continues the process of digestion in the small intestine, whereas a slightly alkaline environment will promote maximum enzymatic activity. The average optimal pH is 7 to 9. And the mode of action of your trypsin is anti-inflammatory effect. How it happens? It is due to your inhibitory action of your vascular permeability, lowering the pro-inflammatory cytokine. Trypsin will enhance the fibrinolysis. It also has been shown to modulate cytokine level in bones. So what are the therapeutic use of trypsin? Trypsin is used for your wound and ulcer cleansing to remove the necrotic tissue and debris and enhance the wound healing. Trypsin will possess anti-inflammatory and thrombolytic properties, and studies indicate good results in therapy of diabetic cellulitis with chronic infected leg ulcers, arthritis, and disorder. The next is your bromelain. Bromelain belongs to a group of protein digesting enzyme called as cysteine proteases. It is obtained commercially as a crude aqueous extract obtained from the stem and the fruit of your pineapple. Bromelain can be absorbed in your human intestine without degradation and without losing its biological activity. Bromelain exhibit anti-inflammatory, anti-edematous, anti-thrombotic, and fibrinolytic activity. Bromelain shows excellent analgesic and anti-inflammatory effect. It also inhibits your arachidonic acid pathway. There is inhibition of your pro-inflammatory mediator, bradykinin, at the site of inflammation that results in reduced vascular permeability. It also limits the formation of fibrin by reduction of clotting cascade intermediates. Bromine basically influences your inflammatory, clotting, and pain process. So main therapeutic use are, it plays a very important role in chronic inflammation, such as malignancy and autoimmune disease. It is used as an anti-inflammatory and analgesic agent to treat the symptoms of arthritis. It is also used for acute inflammation and sports injury, beneficial for debridement of your necrotic tissue and acceleration of healing. Bromelain before surgery will reduce the average number of days for complete disappearance of pain and post-operative inflammation. The next is papain. Papain is a cysteine protease enzyme found naturally in papaya and manufactured from the latex of raw papaya fruits. The greener the fruit, more active is the papain. Papain shows extensive proteolytic activity towards protein, short-chain peptides, amino acids, and ester and amide link. It is single-chain globular protein that consists of 2 and 2 amino acids with 4 disulfide bridge. It is stable and active even at elevated temperature. The pH is 3 to 12. So what is the mode of action for papain? It is analgesic and anti-inflammatory activity. It acts as a debris removing agent. It will actually effectively separate devitalized tissue, bacteria, and blood from your wound surface with no harmful effect of sound tissue because of your enzyme specificity acting only on the tissue which lack the alpha-1 antitrypsin plasmatic antiprotease that will inhibit the proteolysis in healthy tissue. Papain basically helps in wound regeneration. So overall, papain has analgesic, anti-inflammatory, and act as a debris removing agent. Papain uses are for basically to treat sports injury, trauma, and allergies. Papain will decrease the pain, body temperature, and decrease the inflammatory reaction. And the wound in patient with burn, diabetic foot ulcer. Papain also will decrease the need for surgical debridement with its risk of blood loss and operative complication. It is effective in desloughing the necrotic tissue, preventing burn wound infection. The last is your rutoside. It is a natural flavored derivative found abundantly in plants, that is your buckwheat, tea, and apple. It is a powerful antioxidant, beneficial in chronic inflammatory condition. It shows to possess antibacterial, antidiarrheal, anti-ulcer, myocardial protective mechanism. Plasma level of rutoside will decrease rapidly after oral administration. Ingested rutoside is hydrolyzed to quercetin in the intestine and further changed to other conjugated metabolites. So what are the mode of action of your rutoside? It causes inhibition of your platelet aggregation. It decreases vascular permeability. It also improves the vascular flow and improving the circulation. It will strengthen the capillaries and prevent edema. It will combat the harmful free radicals such as nitric oxide released during the inflammatory process. Suppression of major inflammatory and pro-arthritic mediators of macrophages such as interleukin 1 beta and TNF alpha. What are the therapeutic use of rutoside? It will reduce oxidative stress. It enhances the wound healing and promotes the formation of a new epithelia and thicker coagulation. It also reduces inflammatory manifestation in human arthritis and inflammatory disease. But yes, everything comes with, as we know, every coin has two sides, so as your medicine. So you have to be having special precautions because papain and bromelain can increase the blood thinning effect of warfarin. Bromelain should not be mixed with sedative drugs. Pregnancy and lactation. It is not enough known that trypsin is safe or no, but you should avoid in case of your pregnancy. What are the safety effects of your TPBR? Trypsin is generally regarded as safe substance for use. Bromelain is considered to be non-toxic and without any side effects. Rutoside is safe and tolerated with few side effects such as dizziness, headache, diarrhea, stomach upset, and fatigue. Enzyme rutoside combination will exhibit better safety and tolerability as compared to your NSAIDs. So what are the benefit effects? It decreases capillary permeability and prevents edema. It decreases the inflammatory response, decreases clot-forming fibrin deposits, improves blood circulation, improves healing and tissue repair, strengthens the capillary walls. It is also equivalent analgesic activity to your NSAIDs and shows a very good antioxidant effect. So to sum up, your TPBR is effective to relief in terms of your pain, swelling, inflammation, and wound healing. There are few case reports to be put a highlight, so we'll just have a look about it. Trypsin, rutoside, and bromelain alone and fixed dose combination, a natural safer and effective anti-inflammatory agent. So, considering the fact the use of drug of your natural origin with lesser hazard is a positive alternative. Bromelain, rutoside, and trypsin are known to have a very promising effect in relieving inflammation and to promote wound healing. The bromelain, rutoside, and trypsin combination might be a safer alternative in comparison to other drugs for musculoskeletal condition. The next is the impact of your systemic enzyme sublimation on low-grade inflammation in humans. Here, they have shown that the supplementation with systemic enzyme may accentuate your subclinical inflammation with perhaps greater effect among men's as compared to women's. The next is bromelain, all about its biochemistry, pharmacology, and medical use. Bromelain, due to its efficacy after oral administration, its safety and lack of undesired side effect, bromelain has earned a lot of higher acceptance and compliance among the patient. It is also true that bromelain effect on the modulation of your immune function is a potential to eliminate burn debris and accelerate wound healing. The next is efficacy of papain-based wound cleanser in promoting wound regeneration. It is said that wound healing effect, papain-based wound cleaning is integrated with antibacterial properties, which make it a complete package for wound management. However, further studies show that to be carried to ensure its safety for your human usage. So thank you everyone for patiently listening to me. I am personally using Tolib since a lot of time ahead, and I've actually got very promising results. So that was all about Tolib. I hope you will all inculcate Tolib into your daily practice. Thank you everyone for patiently listening to me.
Participating doctors, if you have any questions, you can type in those questions in the message box. Anyone has a question, please type in. Yeah, so far so good.
Yeah,
So thank you, doctor, so much for your knowledgeable and insightful lecture,
yeah,
uh, helping us understand Tolib in a better way. So thank you for your time as well.
yeah. Thank you, Hetero Health Pharma Group, for giving me the opportunity. Thank you.
Thanks a lot, ma'am.
Thank you. Thank you.